Hello and welcome to Aging Well with Dr. Bob. I'm Dr. Bob Flaherty. I'm a family physician and today I'll be discussing changes with aging. Our bodies change as we age and I'm frequently asked, how do I know which changes are a normal part of aging and which changes are more worrisome and need to be checked? In this presentation, Changes with Aging Part 1, I will discuss some normal changes with aging as well as red flags that need to be checked by your healthcare provider. In a subsequent presentation, Changes with Aging Part 2, I will discuss additional normal changes and red flags. The information in this presentation is supported by high-quality medical research, expert medical opinion, and 50 years of medical practice experience. References are given at the end of the presentation. This presentation is for information only. If you have any questions, be sure to discuss it with your doctor, physician assistant, or nurse practitioner. First, let's talk about how we get old. There are a number of theories. One is the cellular senescence theory. Most cells divide as we age, but stop dividing after a certain number of cell divisions. This is probably because the ends of their chromosomes, called telomeres, become too short to allow cell division. Notice in the right image how the green tips of the chromosomes, the telomeres, shorten as we age. Usually the immune system gets rid of the senescent cell. Some senescent cells don't get removed, but remain and stimulate organ damage, inflammation, and even cancer. A second theory is the somatic mutation theory. DNA mutates spontaneously. The higher the mutation rate, the shorter the lifespan. For example, humans average 47 mutations per year, have average lifespan of 73 years. Mice average 796 mutations per year and have an average lifespan of only 4 years. There are other theories of aging, but these are all theories and none of them have been absolutely proven. Many of these changes as we age are part of normal aging, but some of these changes are abnormal and even dangerous. How can we tell which changes are which? Well, I hope today to give you some idea. Let's talk about the normal changes in the cardiovascular system. Blood vessels stiffen, which causes systolic blood pressure, the upper number, to go up while diastolic blood pressure, the lower number, generally stays the same. Also, as we age, heart rate may decrease a little. And also heart muscle cells weaken, which can cause heart failure, with symptoms of swollen ankles, which we call edema, and increasing fatigue. And another normal change is that heart valves thicken, so that a new heart murmur can appear. Some red flags, the changes in the cardiovascular system that we need to be concerned about, include irregular heartbeat or skip beats, increasing shortness of breath, swollen ankles, edema, and increasing fatigue. But a very serious red flag is any chest pain that lasts longer than 15 minutes, and that needs a trip to the emergency room. Normal changes in the lungs include decreased lung capacity, less air getting into the lungs, so we get winded easier. Also, the tiny air sacs in our lungs lose shape and become less efficient in transmitting oxygen from the lung sacs into the bloodstream, and we get winded easier for that reason. Red flags related to the lungs include snoring, which could be sleep apnea, chronic cough, pain with breathing, coughing up blood, all of which would be good to discuss with your healthcare provider. But more importantly, acute shortness of breath could be very serious and requires an emergency room visit. Our gastrointestinal tract includes the esophagus, the stomach, the small and large intestines, as well as the liver and the pancreas and the gallbladder. Normal changes that occur with aging in the gastrointestinal tract take place, for instance, in the colon, where structural changes to the colon can result in constipation. Also, the liver, as it ages, is less able to break down our medications so that they can build up in the bloodstream and cause increased side effects. Red flags related to the gastrointestinal tract include worsening constipation, diarrhea lasting for 4 or more weeks, blood in the stool, low-grade abdominal pain lasting 4 or more weeks, and vomiting lasting more than 24 hours, all of which would be good to discuss with your healthcare provider. More significantly and more immediately, acute abdominal pain needs to be checked in the emergency room. The musculoskeletal system, our muscles and our bones, undergo normal changes that include bone loss, which can result in fractures and loss of height. Also, our muscles lose mass, strength, endurance, and flexibility, which can contribute to worsening coordination, stability, and balance. Red flags related to the musculoskeletal system include a swollen red painful joint with or without trauma, back pain lasting longer than 3 weeks, and leg cramps with walking. But severe sudden back pain or limb pain with or without trauma should cause you to head to the emergency room. Our urinary system also undergoes normal changes with aging. For example, the kidney is less able to excrete medications, so they can build up in our body and result in increased side effects. Our bladder becomes less elastic, so it does not empty completely, which means we end up urinating more frequently. Weakened bladder muscles can also result in incomplete emptying and loss of bladder control. And in men, the prostate enlarges, which can result in incomplete emptying, loss of bladder control, and bladder irritation. Red flags related to the urinary system as we age include blood in the urine and urinary burning frequency or urgency. And if you're unable to pass urine at all, that needs an emergency room visit. We all know that the brain ages as well. Normal changes include mild cognitive problems that don't interfere with our activities of daily living. This can include minor short-term memory changes, occasionally forgetting names or words, minor difficulty with multitasking, taking longer to learn new things, and also sleeping fewer hours and frequent awakening and napping. A major red flag related to the brain is a stroke. And here are recommendations for how to spot a stroke. A stroke requires an immediate visit to the emergency room. The phrase that's used is be fast, with the B standing for changes in balance like loss of balance, headache, or dizziness. E is acute changes in your vision, in your eyes. F stands for face, with one side of the face drooping. A is related to the arms, with weakness of the arms or the legs. S refers to speech, with speech difficulty like slurring or inability to speak. And T stands for time, and time is crucial. So with any of these symptoms, it's time to call for an ambulance immediately. More red flags related to the brain. Although not an emergency, it's important to talk with your healthcare provider if you note worsening memory problems, difficulty managing appointments, your checkbook, or your medications, asking the same questions over and over again, having trouble following recipes or directions. Additional red flags are becoming more confused about time, people, and places, getting lost in places a person knows well, and not taking care of oneself, eating poorly, not bathing, or behaving unsafely. And the take-home message about cognitive changes is if cognitive changes interfere with your daily activities, get checked by your health provider. I hope you found these helpful, and let me leave you with a final thought. Even though we're getting old, enjoy life. Thank you for watching this presentation. I hope you found it informative and helpful. If you did, please click like below and subscribe to keep up to date with new presentations. Please note also that 2 screens of references follow this screen. Best wishes and age well.